pulse oximeter is a tool that we use. This is a very simple one. This was bought off of eBay, I think $45. And what a pulse ox does is it measures the oxygen saturation in the patient's blood. It has a beam in there, a red beam, that goes through the finger, and it can decide what the rate of oxygen has made it to the tips of the fingers or the tip of the head. And how a pulse ox works is that the oxygen that we breathe in goes down into our lungs, goes into the alveoli, the blood vessels come along, pick up the oxygen, carry it to the heart where it mixes the oxygen with the red blood cells, and then it pumps it to all the different extremities in our body. And that's the tip of your nose, it can be your earlobe, can be the top of your ear, your toes, even the bridge of your nose. Anywhere that you could put a pulse ox, I can't put this one on the bridge of my nose. What you need to know is that before you go in and touch that patient, you need to cleanse your hands. And when you cleanse your hands, do it in front of the patient so the patient knows and sees you've done it. I can also cleanse the pulse oximeter at the same time. If it cleans the bacteria that's on my hands, it's going to clean the bacteria on my pulse ox. I don't have to take another step of opening an alcohol swab. It'll clean the bacteria that's on my stethoscope. Just cleanse your hands and then wipe your tool down. The face of the pulse oximeter actually gives you two readings. It is going to give you your oxygen saturation rate. A normal oxygen saturation for anybody walking around day to day is 92 to 100 is normal. Anything less than 92% is abnormal. Pulse ox also will give you a heart rate, and that's all they give you. It gives you a rate. It does not give you the strength. It doesn't give you the rhythm. And your doctors want the rate and the rhythm and the strength. And the pulse ox can't do that. That's why you're more important than a pulse ox. So don't use your pulse ox to take a heart rate. You're going to place the pulse oximeter on your patient's clean finger. And if they have acrylic nails or really thick polish, it might not be able to give you a reading with the beam that goes through there. Don't give up. Give it a few seconds. If you don't get a reading, take the finger and turn it sideways. Sometimes you'll get a reading and it's not being interfered with a thick nail or acrylic nails. So I'm going to go back to the regular way, and I told you that 92 to 100 is normal, and I'm not normal right now. But it takes a few seconds for it to get up there and to figure out what you are, and we said 92 to 100 is normal. Anything less than 92 needs to be reported to the physician. You need to document the pulse oximetry into the medical record, and you need to note if the patient was on room air or if they had oxygen on at the time you were taking a pulse ox. So 92 to 100 is normal. Anything other than that needs to be reported to the physician. You can place the pulse oximeter on the patient's finger, on any finger except the thumb. The thumbs are just too big. You can place it on a toe. I prefer not to use toes of adults. This type of Nonin pulse oximeter is actually only used on patients who are 45 pounds and heavier. So if you have a baby Nonin that has the cord and then the little apparatus that wraps around the finger, and they're single use only, you wrap it around a finger, you can put that on an earlobe, or you can put it on the top of the ear. You can place it across the bridge of the nose and even on the forehead. It will tell you the oxygen saturation that is in their blood. Once again, this is a very small part of the big picture, but your doctor wants to put the whole picture together and you're helping him. I'm Karen Wary with Health Texas Provider Network.